So it's great having you here in Romania. Actually, it's amazing having you here in Romania. I have a few questions for you, if you allowed me to ask. How do you become interested in immediate dentoalveolar restoration? How was your first case? How came the idea to go on this path?
So first of all, thanks a lot for inviting me for this interview.
Yes.
It's a great pleasure to share with you my experience on that.
Okay.
I just came with this approach because I had been done many other approaches according to the literature, but I fail a lot when we perform GBR, when we wait many months in order to deliver the final restoration. I wasn't completely upset about the final outcome related to the position of the gingival architecture.
Yes, totally.
So, and suddenly one day I was working in my office and I have like an insight.
Wow.
And I had been using bone from the maxillary tuberosity for many other reasons. And one day I decided, as I realized that it was missing the buccal wall, since we extracted tooth, I decided to take the block bone from the tuberosity to put the implant in place to make the provisional restoration. And 1 week later, when I saw the patient, I was in state of shock because I realized that I discovered something quite new.
Wow.
And since that point, I have been applying for many other indications, and the outcome was absolutely the same or much more beautiful than the previous one.
Yes.
So that's the true story where I started the IDR approach.
Amazing. Actually, you said it, there are a few surgical protocols to regenerate the bone, especially in the aesthetic area. How do we choose the right one?
What I believe most. No, I believe most in biology.
Of course.
I think the most advantages of using this kind of graft, doesn't matter if you use only bone or bone and soft tissue harvest from the maxillary tuberosity, is the biology. When we use this kind of graft, you will have the best outcomes ever in the bone regeneration and soft tissue regeneration. Make a comparison with the other donor sites from the patients. So when we start doing this procedure and we realize that can be applied for several other indications, I noticed that that's the right way to go.
Okay, great. Actually, you have studied like perio, prosto, also implantology, of course. Did you had like any mentors on your path who influenced you in a
Yes, in Brazil, especially in Brazil, because I did my specialization, my master and my doctorate degree in Brazil.
All of them.
And I have good mentors. Everybody should have mentors in order to follow.
Yes.
And I had an amazing opportunity to meet this guy in my life because they changed completely the way of thinking.
Okay.
And I would say many thanks for them to be part of my career because I changed my career. It's because of me and because of them.
Yes.
Everybody should have some mentors in order to follow. That's my recommendation for the young generation too.
Great. Tell me some things or values that you took from your mentors and maybe from your family, and maybe you want to, let's say, present to our colleagues so they can have some guidelines, through their
That's a very good question. What I learned from my mentors and from my family too. This is what I learned from my father.
Okay.
Every time that you are doing something in your patients, do your best.
Okay.
And don't do anything in the patient's mouth that you wouldn't do in your mouth.
Okay.
That's my recommendation for everybody, everywhere.
Yes.
When I discuss it about some clinical case, I would say, would you do something like this in your mouth? If you do, go ahead. If you don't do, never do in the patient's mouth. So this is what I learned from my mentors and from my father too. For all my family, they think the same way. So what's my recommendation for everybody now? Try to offer for your patient the best outcomes ever. If you think about biology, try to use the autogenous bone because the autogenous bone is still a gold standard.
Yes. Actually, what do you think it is the main innovation in implant dentistry, let's say, in the past couple of years?
we have lots of innovation in implantology in the last years. I would say that the digital approach come in our direction.
Yes.
And we got lots of advantages on this kind of approach. What else? Magnification, ossifycation,
yes,
and IDR. For me, this is the main four advantages that you may have in the last years.
Okay.
For everybody that usually come to me, I would say, if you never tested this kind of four approaches, magnification, IDR, VersaBurst, and the digital workflow, this is the right way to go.
Great. Actually, I totally understand what's the present of the, let's say, implant dentistry, but can you tell us your, let's say, perspective about the future, maybe about the future of IDR technique?
In the last 5 to 6 years, we did lots of upgrades in the IDR technique.
Okay.
In the past, we used it to apply the IDR technique for those cases that was missing only one wall. When we realized that the outcomes were superb when you talk about the gingival architecture stability.
Yes.
We realized that this kind of approach could be used for different issues. For example, for those cases that's missing the papilla, for those cases that we have high gingival recession, for those cases that we have 360-degree bone loss. So we've been using this technique for such a very challenged clinical case, and the outcomes is absolutely the same that we got for those cases that it was missing only one buccal bone wall.
Yeah.
So that's why I'm so happy to share my experience, to share 20 years of experience on this topic.
Yes.
Everywhere that I am, that's my pleasure nowadays. That's my mission.
Okay.
To share for as many people in the world as possible before I get retired.
Yes, so it's absolutely great. So IDR is not about the central incisor anymore.
No. It was in the past.
Yes, it was in the past.
But nowadays you can apply this technique when we have condemned tooth in anterior zone, posterior zone, upper or down. It doesn't matter the severity of the bone loss and the soft tissue deficiencies. We can manage everything in one single shot without open the flap. That's the main difference between IDR technique and the other approaches available in the literature.
So I realized that you are like a very successful doctor. You share with me that you traveled this year like 200,000 kilometers.
Yes, that's crazy. But according to my agenda this year, at the end of the December, I'm gonna travel 200,000 kilometers. I travel for 30 international courses, 30. And my agenda for next year is worse than this year.
So my next question is, how do you stay grounded? How do you manage to have like a personal life in this, how
to balance this crazy life?
Yeah, with the professional life.
Yes, I have a family that supported me. My wife, my daughter.
Yes.
They know exactly what I'm doing. They know exactly what's about my mission worldwide. And they gave me the main support of my life. They gave me the opportunity to travel because I always missing them when I'm traveling worldwide.
Yes.
But they know exactly what I'm doing. I'm not here, it's because I'm having fun.
Yes.
I'm here, it's because I'm sharing knowledge, sharing my experience.
Yes.
And this is my gasoline. This is my fuel.
Yeah.
When I realized that my mission is to share these kind of benefits, this benefit is not for the dentist. The main benefit is for the patient.
Yeah.
But I need to reach the dentist in order to reach the patient.
Yeah.
So this is my target nowadays, to spread the news as much as possible before
for sure.
I prepare somebody else to be in my place.
No, but for sure you change the world effectively with this kind of protocols. It's amazing. But how a day in your life look like? What's your morning routine, evening routines? Let's say pre-surgical intervention routines.
Yeah, I'm a super morning guy. I usually wake up at 5 in the morning.
Yeah, me too.
I read papers. I prepare my presentations before everybody wake up.
Yes.
In my house, and I go to the gym. I have some time off that I really love to not go to the gym, but also I go cycling. I go trekking. I love to go with my family somewhere else that I never been before.
Yes.
So that's my pleasure, and I would say that that's my fuel. Because without something like this, without any time to relax, there is no energy to share with anybody. So when I collect my energy, when I am in my house with my family, they supported me.
Okay, great. Do you have any words or advices for the young dentists out there, for your younger self, so to say?
Yes, I would say that for young generation. What's my recommendation? When you finish the graduation, I would recommend you to go to the best course ever in dentistry. Doesn't matter which area you are going to focus on, but you need to look for the best tutors, the best teachers, in order to learn the best techniques ever in order to apply in your patients. You cannot be a standard professional. You should be one of the best. If you are one of the best, you deliver for your patient the best outcomes. That's my recommendation for the young generation.
Yeah, great. So thank you so much, Dr. Rosa.
Thank you.
It was great having you here. So next time, I think we will have this kind of interview in Brazil for sure.
It will be a great pleasure to open the doors of my training center in Brazil.
Yeah.
I'll be waiting for you.
Yeah, see you there.
Thank you. See you.
Thank you.